Okay, perfect. So this is called sural nerve, and it supplies, see that area where you're kind of pointing?
Yeah.
Behind the lateral calf there. So we're going to
Okay.
see if this is what your brain wants. All right. So you're in your hinge. Okay. And open your chest a little bit. And then tell me when you have like a 3-4 tension out of 10 on the back of that leg.
Now?
Now, okay. Now that you have it, you can like relax and slouch, like slump your shoulders. Yeah. Okay, here's the leg. Dorsiflexion. Yeah. Ooh. Ankle inversion. So, yes. Oh my gosh, you're amazing. Straight leg. Oh, straight leg raise. Let's leave the leg on the ground. Okay. Hip
That sounds difficult.
I know it sounds really difficult. Hip adduction. Yeah. Internal rotation.
Ooh. Yeah.
Ooh. Now we have two spine things. Spinal lateral flexion away from your right leg.
Spinal.
Lateral, yeah, good, good. Now from here, flex your spine.
Like
Yeah,
that?
yeah. Now get your inversion in your foot back. There we go. And let's floss. Whatever do you think is the most natural spot to floss here? You could do knee, you could do your torso, your foot. Perfect. This comes out of L4, L5, S1, S2, S3. Yeah. And then gently come out of it.
Oh, that's quite tiring.
Oh. It's just kind of, yeah. Maybe just take a second. That one's intense.
Mm,
I'll send you the tensioning sequence. So
okay.
when you feel like you're back, let's
Yeah.
just take a walk down a hallway. You can leave me here, but just try to integrate it in your nervous system, the most normal walk as possible, and then we'll come test it. Okay, take your time.
That's definitely better.
Okay. Whew. What number?
Maybe a 3.
Okay. Let's take a 3.
2/3.
2, 3. You want to try another one? Let's see. I mean, we definitely
What?
haven't done like that
Yeah.
many
Okay.
reps. Okay. So let's do this again. I don't know what this straight leg raise is about. How would you even do that?
Well, I can try and
I
see if
just
I can.
don't like it. It doesn't make sense.
Okay.
So I might have you, you know how, because we kind of have clues about the lumbar sacrum for you. We're going to
Mm-hmm.
get into position, and then I'm going to have you maybe like rub your lumbars or breathe into them or something.
Okay.
Or
Yeah.
maybe even try. Oh, you know what, Bronwen? Can you rotate towards me real quick? Can I see how you can stay seated. It's fine.
Oh, okay.
Yeah. I just kind of want to see how these are testing.
That's
Okay, go
better
ahead.
than when I first did it with you. Remember when
Yeah.
I was doing?
Yeah. Okay, let's see the other side.
It's a bit more mal-coordinated.
Yeah, perfect. Okay. We're gonna mess around here. Like I said, I'm gonna try stacking a lot of stuff with you today. So
Yeah.
let's just get after it. Okay. Here we go. So first things first, you find the position. So right leg goes out. We could also try it on the left too, because it's the same nerve, just
Yeah.
the far end, right? So we don't know. Maybe your body would like that better. But so let's review it on the right. So first, you hinge forward until you have a 3-4 out of 10.
Yeah.
And then you just get to kind of relax because now you know what's coming. Everything will make it more intense. Go slow and dorsiflex. Ooh, yeah. Inversion. Yes. Oh my gosh, that's so good. Hip adduction. Internal rotation.
Yeah.
Oh. Laterally flex your spine away. And then spinal flexion. And then whatever, okay, oh yeah, let's take your left hand and rub your low back. Because that would be your cerebellum having to do this. And then come out, do like maybe 5 flossing techniques with, if you want to do knee, whatever. Yeah, you can rest your hand. That'd be too much to ask. Yeah.
Can I stop now?
Yeah. And then gently come out. Oh, we're just going to come to seated. And just, yeah, good call. I like the slow up. Yeah, just take a second. You're probably like me with like low blood pressure, I'm assuming.
Yeah. Should I go for a walk?
Yeah. Integrate into the body.
Okay.
Okay.
Better.
Yes. What number?
I'd say that's a 1-2.
Hallelujah.
Yeah, no, that's much better.
Okay. So it was either that we did the nerve glide twice or that we added the lumbar skin stim. Right? Like, I don't know.
Yeah, yeah. Or maybe
You got
I was
better at it.
doing, yeah, exactly.
Yeah. So what I was thinking is we could get you down there and doing left cerebellum.
Can I just test it on my left knee as well? Yeah, because presumably, because the left knee
Mm-hmm.
is in exactly the same place,
Yeah.
so presumably it will help both legs, will it?
Oh, yeah. Oh, yeah,
Okay.
totally. So think
Yeah.
about this. It's the same nerve, and it just
Yeah.
goes through the spinal cord and then pops out the other side. Like,
Okay.
it's like a rubber band, if you like pull on this end, you definitely pull on that end.
Yeah.
So what might be interesting but freaking hard is if we were really trying to like go in the center, like let me just see if it's possible. You know what you would floss with instead of the knee is you would floss with your pelvis.
Really?
Yeah.
What, me with my stiff pelvis?
Exactly. I mean, that just sounds hard. So like you get what I'm saying? You have the nerve at this full stretched position.
Yeah.
And then you drive the movement with the pelvis. Maybe it's just, and then come out. But yeah, I mean,
Maybe.
yeah. this is like what makes sense to my brain because you have lumbar stuff.
Yeah.
Floss it right at the area and then it would go down both legs. But the thing is, what we just did was really awesome. So there's like these decisions we have to make as like a partnership. Like, should we just be happy with a 1-2? Or do we try something else with the possible outcome of making it worse, right? Like, what if we try something and it goes up to a 3 and I'm like,
Oh, okay.
You know what I'm saying? So it's like, I'm kind of happy with a 1-2 for you because that's a big jump.
Yeah. Because
Right?
when we, at the beginning of the session, it was more like an 8.
Yeah. That's pretty good. For like,
Okay.
think about it. We talked and then we tried some stuff. So this part really only took us 10 minutes.
Yeah.
Like just this, you know what I mean? Just this
Yeah,
part.
yeah.
So
Yeah.
I feel like we should probably be happy with that. But
Yeah.
so let me I'm gonna send you this. I'm gonna send you a photo of this nerve guide. And then the other thing with nerves, Bronwen, is that is called like stretching the nerve.
Mm-hmm.
You can also slack it, like just, like you take the nerve, and what we did was this.
Yeah.
Sometimes nerves want to be like
Okay. Yeah.
unactivated, if that makes sense, which I don't think yours does. But what it might want is something called sliding. So you go like, you would take your body, let me try to mirror you. Let's say this is too high for me, but let's say I'm in the nerve glide, boom. And you would move, oh wait, I would be like this. You would move like 2 things like this.
Oh, okay.
You know what, like 2 ends. Oh, you can't see my head, but like, let's say this is a nerve glide. Well, actually, we're going to do this in a second. You would take 2 ends and move them instead of just driving with one joint.
Yeah. Yeah.
That could possibly be effective for you also. But like I said, we're at a 1-2. I think we're both super happy with that.
Yeah, 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 yeah.
Why give you something more complicated? That's probably the most complicated nerve glide that there is.
Oh, is it? Okay.
It's like your foot has to be like this, and you have to, like, I mean, everything else is like pretty easy compared to that one.
Yeah.
Okay.
What about doing the drill, but also stacking other things that I've done with the other? So like the tongue in the cheek and the humming and the
Exactly. Like I almost had you like get in it and stare at your toe and like do a vestibular exercise. Or you put an essential oil by your face, plug the nostril. Totally. So if you have your list, you could almost get into your nerve glide and like have your notebook out and be like, okay, let's try tongue in left cheek. And then tongue in right cheek. Humming. Music in one ear. Have we done that?
Yeah. You've talked about that. So presumably that's still music in my right ear, is it?
It would be, yeah. I would think.
Okay.
So, but that, did I tell you? So if you do test music, you just want to make sure it's very intelligent music. Did we talk about that part?
What does that mean?
So I know. So it has to be like Mozart and Beethoven and like
not pop.
Yeah, exactly.
Or rap.
Yeah, because so I learned that from a diplomat of chiropractic neurology, and he said, you need music in your right ear. And I said, oh, well, awesome. I can listen to country, right? because I listen to country music, and he was like, absolutely not. Like, no. And I was like, what? So he said it's not intelligent enough. Like the chords are just like three, and like it has to be like a mathematical design. So
okay, yeah,
the other cue with that is also I would go as low volume as you can possibly hear it.
okay,
Like I wouldn't do it loud at all, especially because these pods, Bronwyn, are inside your ear. They are like right on your hairs that pick up sound. It's like really close. If you had over the earphones, it'd be like a little different.
okay.
Which I don't take you as like a blasting music type, or are you?
No.
Okay. Some people, I know a lot of people that are, but it's really bad for your brain. The people
So
that
are these not good then? These things?
they're okay. But you know, in our neuro rehab training, they're just a little more. I would say this: the preference would be the over the ear headphones.
Okay. Yeah.
Because if you look at it, it distributes the sound wavelengths like around and on your skull versus inside your canal. I mean, it's just breaking straight to cranial nerve 8, which is vestibulocochlear. You don't have to worry. It's okay, but just definitely never blasting it with music, right? Because you're a primal being. You would never have something inside your ear creating noise.
Yeah. Okay.
If we weren't like 2019 super cool. Right? Like you would just live in a cave and like hear noises. Like
yeah. Okay. No,
you're okay. But yeah, I would the music do you want to test it or you want to do it later?
Yeah.
Because I know you'd have to like
yeah, I don't know how it works.
You'd have to like pair it with something else. Yeah, let's do it later.
Yeah.
So here's what you would do. You'll pair your thingies with classical whatever, Beethoven, okay, Mozart. And then put it on the lowest volume you can hear.
Yeah.
Do an assessment, toe touch, torso rotation. You can use your knee if you want to. I wouldn't recommend it. I would just do something unrelated.
Yeah.
And then take one out, right? Go for a walk just down the hallway like we're doing. Come back and then retest something.
Okay.
And then switch ears.
Yeah.
And then walk, retest it.
Yeah.
And you'll know, in like a minute which ear you should be doing.
Okay. Yeah, no, that's fine.
Now, what if that tests really well and you have one earbud in your ear, your tongue in your left cheek while you're smelling something and do the nerve glide?
That sounds like a lot. Okay.
But it is what's like kind of annoying with neurology is some people need very little stimulus, and that's nice because it's like what we're looking for together is the minimal effective dose.
Yeah.
Like sometimes for you, some stimulus is not enough because you're an athlete, and the more advanced the athlete, sometimes the heavier the load needs to be.
Yeah.
Like sometimes I need to like F with people. Like if I was with you and you were doing something, I might like push you a little bit and like make you have to error correct and kind of make it harder for you, and you probably test really well.
Okay.
So you kind of think of it like that. The more athletic you are, sometimes the more load you need.
Yeah.
I would say most of the time, to be honest.
Yeah. Okay.
Unless there's something like this, that's kind of a lot of load because it's kind of hard originally.
Yeah.
Okay, so we feel good about that. We can work on left wrist.
Yeah.
Okay.
Yeah. No, that's.
I'm stoked on that.
Yeah. No, that's good.
Okay, cool. Okay, so let's go to left wrist. I think you do really well with nerve glides. So why don't you want to try your push-up position or the hand cleaning position?
Yeah.
The thing is, because, yeah, you won't do that very much, but I do still want to get rid of it.
You know what? It almost feels a little bit better.
Oh, cool. Okay. That's what I was hoping for.
If I'm comparing it to the other side, it's not hugely different
Awesome. Okay.
because there is pain on that side, but that's normal.
Feels better.
Yeah, maybe
Remember?
not.
Oh, maybe not.
Well, no, I mean, it definitely feels different to when we did it at the beginning of the session.
Okay. So better.
But yeah, so it's difficult to know what number to put on it because when I do it on the right side, there is pain. So it's
It's
working
also
out
in
what
the
is.
same spot.
Yeah, but I'm assuming that's just normal type of uncomfortable pain on the same spot, no?
Well, okay, let's talk about this. So pain is like you can't really breathe through it. Discomfort is like, this sucks, but I can breathe through it. Pain is like an uh-oh feeling.
Okay,
Like,
so maybe it's a discomfort
right,
then.
like when I go into it, I don't like that. That doesn't feel good. Yeah, I don't like
Uh,
Yeah,
so
like
in term,
my right
okay,
one, I'd
in terms
probably
of,
give like a 3-4 in discomfort.
I'd say on the right, it's maybe a 3-4. On the left, it might be more of a 5-5 discomfort.
Okay.
So, there's a bit of a difference, but it's
Yeah.
definitely better than the beginning of the session.
Okay. Well, let's see what happens because if it matters to you, I think like you were cleaning and it didn't feel good.
Yeah.
But like you get like that position's just no bueno, right? Because these little carpal bones, we smash them and then we compress them.
Yeah.
It's kind of like not a fantastic move, but if you do have to get into it, like you said, if Phil has you crawl
Yeah,
10
which he
steps
will
this
do.
way, 10 steps this way, 10 lateral, 10 lateral, like I get it. You're like, and then there's also stuff with technique you can play with. Like when you go to the side, are you keeping weight on your thumb and your index finger?
No,
Nothing.
it goes no.
Right? Like if you let your hands roll out, that's not good. You want to
Yeah.
keep this flat on the ground. So just,
Yeah.
mess around with technique too.
Yeah.
Squeezing a quarter between your butt, double chin, like all these things to aid this from happening. Okay. So because it's kind of on both sides, now I'm wondering about your neck, which makes sense because your neck is opposite your pelvis.
Yeah.
So let's do this. Let's start simple and then we'll end up with a nerve glide if nothing works. Okay. So can you just reach back there? Let's use your left hand. The nub that pops out at the end?
Yeah.
Yep. That's T1. So I want you to touch T1 and like go up one vertebra and try to get that area, like the very base of the neck. And let's do like a good 20 seconds on this. Yeah. Okay, now we're gonna do 5 of these guys where you're from neutral. You're gonna like make a really big double chin and tuck your chin down. Actually, we could probably jet forward and back. Let's see what happens. Have you done this?
No.
It's like a chicken neck motion.
Uh-uh.
Okay, now when you go to the back, pause and tuck your chin down there. Now keep it parallel to the floor and jet your chin forward and keep it down when you pull it back. Yep. I'm basically trying to stretch the base of the neck. Okay, hold it here and just take one breath. All right, and let's try our plank thing. I don't know what to call that.
No, neither do I.
Okay.
Yeah, that feels better.
That better?
Yeah.
What number's that?
I'd say it's the same on both. Oh, maybe it. Very similar on both sides.
Mm.
Like a 3, maybe?
Oh, that is better.
Yeah.
Okay. Awesome. We get to add to your list. What I like about this for you, though, is you can do this all the time.
Yeah.
Like before you wash dishes, before, you could be doing it seated. Now, just make sure, because what we want, Bronwen, is I don't really care about this one, but it's nice to get the range. But I really care about this position. Make sure there's no wrinkles on the back of the neck, that the chin is down, and you're trying to like really stretch the back of the, yeah. Now, yeah, that one. Yep. Okay, now push your shoulders down and relax your shoulders. There we go.
Yeah, I'm struggling to relax them. Like that.
Yes. There, yep. Mm-hmm.
I feel like I need to frown when I do it.
Total.
I've got a client who every exercise, when she does it, she frowns.
What?
She does this.
Why?
I've no idea. I don't feel like saying anything to her, but it makes me laugh every time. It's like, oh, that's not
You
right.
don't want to say, hey, just relax your face.
Well, I might say.
Maybe, yeah, that's what I always go, relax your face, your jaw.
I'd have to say it in a very polite way because
Right.
she's incredibly vain.
Oh.
Okay.
You know what, though? What's good is if she is vain, she's like causing extra wrinkles.
Yeah.
Right?
No, that's true. I wouldn't want to. Don't do that.
Don't create more wrinkles, right? Speak her language. Yeah. Yeah, exactly. So if you ever question your position on these, okay, relax your shoulders, relax.
See, with that one, I feel like my posture suddenly gets really bad. So I
maybe we should sit you down.
I feel like you always talk about lengthening your spine.
Yeah.
Yet when I do it, I feel like I'm hunched over.
Okay, so yeah, let's just, how are we gonna, okay, you know what we could do is put your back against that looks better. Is that better?
Yeah, no, it feels better actually.
That's better. Now pause, exhale, relax your shoulders. Good. Now right there, try to relax everything as there. It's just a neck exercise. Nothing else is invited to this party. Yeah. And hold. Now take a breath. And just take a rest. Left arm, skin stem. I want to try this again because now you've done quite a few.
Yeah.
After like 10 seconds, let's try our little thingy.
That's better.
Wow, you have way more range. Holy crap.
Yeah, so there's no Yeah, I'd say that's all
What
right.
number?
You want a 0?
Or even a 2.5, whatever.
No, I'd say it's definitely like a 1.
Cool. I
I'm
mean,
happy with that number.
that's like really awesome. So, did we talk about this? Like, if you ever have anything bilateral, you want to be thinking midline.
Mm-hmm.
It's really rare that you're going to have bilateral this and this, bilateral knee. Like, yes, it started off as only one, but now it's the other one. And then you said the exact same spot. So you kind of want to be thinking spine.
Yeah.
Or spine and eyes if there is a bilateral issue, because it is just so evident, because it's very uncommon to have the same issue on both sides of the body. Usually it's, my right shoulder, left hip, right pinky, left ankle, whatever. So when you're not with me or with your clients, right, if they say both elbows hurt, you're going to go spine.
Yeah.
And where the nerves supply the muscles of the arm is at the base of the neck.
Okay.
Right? Comes out of the neck and goes, and then gives the shoulder, biceps, forearm, fingers, all the information. So we know for you, which I just learned this today because we've just never had to go here before, is you tended to kind of have like a chin lift. Now, if these are my vertebra, right, this is the posterior vertebra.
Yeah.
They're smashed. And then the second you tuck the chin, they open. Right? But if you're like this, they're compressed.
Yeah.
Smashing those nerves.
Which is potentially why I got the kind of shoulder issue in the first place, because that all came on when I was doing pull-ups. And I know I was doing this, and it just kind of came on from nowhere. So that would be why, would it? So it's another thing.
Oh my gosh. Were you alone?
Yeah.
Oh, girl. Maybe you should start recording some of your movements so you can see how, you know what I mean, how you're doing, because you obviously know you're not going to do that in your pull-up. Like, did you prep for that? Like, do you do scapular pull-ups?
I don't think I can do a pull-up at the moment. So when I go back to training with Phil, I want to start off from the basics and build back up and do it properly.
Make sure you tell him that that's what happened, right? Because we have to get your lats to make sure they're, so tell him that I said, or I could probably tell him if I remember.
I think he was going to speak to you anyway, just to
good, just to catch
what we've done.
So I'll tell him. But I call them turtle giraffes, where you hang on a bar or TRX or something, and you just you know what I'm talking about.
Yeah.
And you're from a dead hang. It's hard. It's hard, but it's easy. But you want to be able to do a ton of those before we try to get your pull-up back. Or, start with chin-ups.
To rush it.
I
was just like, I want to do a pull-up because that looks hard.
It is hard.
And I know.
Let's get your chin up first. Your flexed arm hang should be at a minute before you even do a pull-up.
Yeah.
I'm talking beautiful too.
Yeah.
So
I really want to look at technique, because I think that's where I went wrong.
Cool. I would love to see that. Like, I would love to see your flexed arm hang position. And it's hard. Like, I'm at like 50 seconds on my flexed arm hang, and it is, I am working for that.
Yeah.
So as long as you're around 50 seconds to a minute and your neck is so long and your freaking abs better be fired up, right? Like in a hollow body.
Yeah.
I'll talk to him. I'll talk to him. I'm going to be like, make sure. Yeah.
No, I want to do it kind of sensibly, because what